Okay, good afternoon, everyone, and welcome to our session on breaking down barriers, real examples of Kentucky communities making positive change. I'm Rufus Friday, your moderator this afternoon, and our panelists today will share with you how they are connecting families with early childhood intervention services, public schools, public health collaborations on mental health services, and how a community is working to chart paths for non-traditional career building. So let me start off by introducing today's esteemed panelists. Ashley Brandt is the Director of Early Care and Education at the Metro United Way, where she leads Jefferson County's Early Childhood Collective Impact Initiative, the Ready for K Alliance. Ready for K's mission is to improve outcomes for children throughout Jefferson County, ensuring all children entering kindergarten are ready to thrive. Ashley moved to Louisville in 2016 to attend graduate school at the University of Louisville, graduating with her MBA in 2017. And she has over 15 years of experience in early childhood, including 8 years as an early childhood educator in Washington, D.C. Next, we have Jen Harris. Jen is the Public Health Director at Todd County Health Department in the Western Kentucky community of Elkton. Jen has her bachelor's degree from the University of Kentucky in exercise science and a master's degree from Austin Peay State University in public and community health. She has 25 years of experience in public health, working her way up from a health educator to the leadership position she is in today. Jen is an outside-of-the-box leader who has helped develop and carry out public health in her community in a non-traditional way by forming partnerships with like-minded local professionals. The Access program that you'll hear about today is a perfect example of the kind of partnership and displays how community needs can be addressed in a way that is respectful to our families. And then we have Dr. Robert Boone, who is a senior level executive in the field of workforce development, having earned a unique depth of experience in the private healthcare, post-secondary education, nonprofit, and private workforce development program management and software arenas. Dr. Boone consults in some of the largest United States markets as Chief Officer at National Workforce Solutions for Career Team. Dr. Boone has a track record of leading an entrepreneurial and systems-based approach to building workforce development organizations. He is recognized as an expert in innovative program design and delivery in workforce development, organizational strategic planning, and transformation, and the orchestration of technology platforms to create large-scale solutions resulting in performance-based and customer-centered workforce systems. Just so everyone knows, at the conclusion of the presentations, if you have any questions, please put them in the chat box and I'll go through them as time permits. And if you want a specific presenter to comment on your question, just please note that in your questions. So with that in mind, we'll go ahead and get started off with, we'll start off with Ashley Brandt, then Jen Harrison, and finally Dr. Boone. Ashley?
Great. Thank you so much, Rufus, for the introduction. As Rufus mentioned, I am going to discuss Jefferson County's early childhood initiative called the Ready for K Alliance. And that is a collective impact initiative that is focused on improving kindergarten readiness and making sure that all children enter kindergarten ready to thrive. And we are a coalition of over 100 local partners, and the work of the Alliance is completely determined and driven by community partners and individuals that are members of the Alliance. And we have a strong focus on coordination between all different sectors within Jefferson County that may have input into this birth to 5 space. So it's a pretty expansive network and a diverse group of partners. So as I mentioned, the end goal of the Alliance is kindergarten readiness, but we know to achieve that goal that there are so many different systems, programs, supports that need to work for children and families. And that includes healthy development and strong health outcomes for children and the adults that surround those children. So we know that the first 5 years are more than what happens between the four walls of a school. And often in that birth to 5 space, there aren't those four walls. Those children are at home, they're out in the community, they may be in pre-K, but that's not guaranteed. So we know that partnerships in working in this birth to 5 space need to be really strong with every partner that is reaching children and families, no matter where that may be. So I'm going to share my screen with some slides to present. Can everybody see that? Yes. Okay. So to start, I'm going to go through just the general framework that we use for this collective impact initiative, so that if you are interested or looking to do something similar, you can see sort of what are the pieces that bring this together. And then I will talk more specifically about actually the work of Ready for K and what our focus areas are. So first, a collective impact initiative, what does this look like? We follow a national model of collective impact. If that's something you're interested, I can share a link in the chat. But this is sort of how we frame our work in Jefferson County in this birth to 5 space. And that starts with agreement on who and what the coalition is and what it is not. I put that in bold because that is such a key piece, especially if you're just starting out in the work and as the work evolves, to say, have very clear guardrails of what are we focused on, what are the ways that we're making progress, what are our roles, and what are not our roles, or how are we not addressing this problem, so that as the work evolves, as more partners become involved, you can really distinguish and say, no, this is what we identified, our clear point and pieces, and how we're going to focus this work on, how we'll evolve this work. And there are so many different amazing groups that you don't have to be doing everything. So having that clear framework set from the beginning, I think is very clear, is very key. And then again, a common agenda. What is the problem? In Jefferson County, we know that 50% of our children show up to the first day of kindergarten not ready to learn, based on the Bergantz screener that we use across Kentucky. That is a problem in our community. So that's what Ready for K has identified, but that can be any sort of problem that you're identifying in your community. And then how are we addressing this problem? So having a problem, a clear understanding of who and what the coalition is, and then how are we going to address this? Like I said, there's so many different partners, programs, organizations, initiatives. So really understanding and defining how this coalition, this work group is going to move forward, and what are the ways you're going to make progress in this space. And then how does this work get done? So that's a bit, you can identify a lot of problems probably, or issues or metrics you want to improve, things you want to build on in your community, but how is that actually happening? So in the model we follow in this framework, there's some really key partners. And I will say the first one is the backbone organization. That, and for the Ready for K Alliance, that is Metro United Way. That is where I work. And we really serve as the sort of the motor that keeps this work going and keeps it moving. And so that we know that after a meeting, after a convening, after a work group comes together and decides on something, there is dedicated staff to keep that work going between those meetings, between those conversations. If we have a new agenda, pulling in the right partners, there's always a staff dedicated to do that. All of that to say, though, that the backbone organization is not the sole decision maker for this initiative. We have a leadership team, and they're really the decision-making body. It's a really diverse group and should be very representative of all of the different sectors and partners that you're working with. And that's really where final decision-making happens. And that is so that it's really collective decision-making. This isn't one organization or one group making those decisions about the work of the collective. And then beyond the leadership team, community partners, those are essential to getting the work done, and they are often the people doing the work. They are the boots on the ground organizations. They are the ones directly serving the community or the individuals that you are trying to reach. And they are the ones that have the insight on really what is needed. What are they seeing? What are families or individuals or children that you're trying to reach coming to them with needs? What are they saying? They are really the ones ones with that insight and are such a key piece to this work, because as a coalition, we can say we want to improve outcomes for children in our community, but how are we actually doing that? And those community partners are the ones that already have those relationships, are already implementing those types of programs. So those are the ones that are really key to have at the table as well. And then finally, clearly defined roles, responsibilities, policies, procedures. There's a lot that goes into this, and as I think it can feel very overwhelming, but having these pieces and developing them as you go makes it, again, it's those guardrails, like I said last slide, having a defined audience, a defined issue, a defined outcomes of how we're going to solve this issue. All of those pieces just help in the conversations and ongoing work of the coalition to say, okay, we said this is what we're focusing on. We said this is how we're doing it. Let's not veer too far off track. And that doesn't mean the work doesn't evolve. It constantly evolves, but it still provides you that framework to stay within and maintain the allegiance to what was originally the goal of the coalition. So now I'm going to talk more specifically about what Ready for K, how we've used this framework to build the Ready for K Alliance. So Ready for K was started in 2014. In 2020, we went through a revision of our logic model. And so a lot of this language has been updated. And this is our mission. So a collaborative network of individuals and organizations, again, naming who this is, committed to a seamless system of support for all children ages birth to kindergarten entry and their families, and I can't see because my Zoom thing, with a focus on improving outcomes and ending disparities for the most underserved children in our community. So this is a key piece of, again, creating that framework, laying those guardrails of what our work is going to look like. I will say this is a long sentence, but the time it took just to get these words and for the coalition to agree on it was a lot of work and a lot of conversation with partners. Again, this wasn't solely formulated by Metro United Way as the backbone organization. It wasn't solely formulated by our leadership team. Drafts were brought to different community partners. What is missing? What words should we wordsmith further? Are we really representing everything in here? So it's every piece of this is a collaboration. There is never any work done through Ready for K that is a sole decision of any one individual or organization. So our backbone, as I mentioned, is Metro United Way. And I just wanted to list here all of the different teams that Metro United Way dedicates to this work. So you can really see sort of how many different entities are supporting this work. And that's not to sort of scare anybody to say, oh my gosh, we need a really robust backbone, but it's just to think about all the different pieces you may need. And also to say that there doesn't have to be a single organization serving as the backbone. If there's 2 or 3 organizations in a community, maybe one can offer support for grants, maybe one can offer their marketing team. That can also all be pulled together to create a backbone coalition that then is able to really support all of these areas. And then on the right, we have a list of different partners that serve as our leadership team. So one thing I want to flag about this is most of these partners were part of the process that established the alliance to begin with. So they've been on board from the beginning, and their membership to our leadership team is never tied to an individual. It's always tied to their organization. So we have our local school district, JCPS, they always have a seat on our leadership team. If their staff may change, someone may retire or just move into a different position, that JCPS will always have a slot in this leadership team, and it's really up to them and as an organization to decide who they want to fill that piece. And that just really helps with turnover, and so there's consistency, so that if someone moves jobs or moves organizations, that you're not sort of then left with a gap in your leadership team. And then as part of the framework, we identified a community-wide vision. As Rufus mentioned, all children enter kindergarten ready to thrive is our vision for Jefferson County. And then these 4 outcome areas are how we said and identified we were going to solve the problem. So we said that healthy development, access and quality, which is focused on access to high quality and affordable care, childcare, family and caregiver engagement, which is focused on supporting the adults and the systems that surround a child, and then systems alignment. These are our 4 areas that, as the coalition has decided, are our top priorities. There are probably a million other ways we can support children and family in Jefferson County, but this is the framework that we set through many conversations with partners and said, this is where we are going to focus. So again, creating that framework so that all the work that happens, we know can fit within this system that we've created. This is just some additional language defining what all of those mean. I'm happy to share these slides later if anyone wants to review. In addition, I will also share the link to Ready for K's website, which has all this information as well as more details. So don't feel if you have to read through all that. Secondly, beyond our outcome areas, Ready for K also has developed an advocacy and policy agenda. This was completely created by our community partners. We met in late 2019, early 2020. I think over almost 200 pages of notes came out of those meetings, and then were distilled down to a 1-page advocacy and policy agenda. Ready for K's advocacy and policy agenda is fully supported by Metro United Way's policy team. So we have dedicated staff that is moving all of these policy priorities forward. But in addition to that, this is an opportunity for us to give power to our coalition to advocate in these spaces. So Ready for K, we have identified these advocacy areas as local ordinances or bills at the state level come forward that align with this. Metro United Way's policy team supports this work by getting that information out to our coalition, by offering call to actions. We have a software we use where people can just enter their zip code, automatically sends notices to your state rep or your local council person. So this is not just improving outcomes for the children through policy, but it's also giving a voice to our coalition, empowering them and giving them the opportunity to advocate in this space. And this is the third part of the policy agenda. Again, a lot there, so don't feel to read it all. I will share that out for anyone who's interested. And then finally, I just wanted to share a couple of recent wins. So this is a coalition of over 100 partners. Like I said, we're working in those 4 different outcomes areas. And what does that actually mean? What actually happens out of that work? One of the biggest defining features of the Ready for K Alliance is we are not direct service. We are working with those partners that are a part of our coalition. They are the ones doing the direct service. So that's how we've defined our work. So in the last couple of years, we did launch one program in partnership with a couple local partners called Louisville Growing Readers. In the first year, over $500,000 books were distributed directly to Jefferson County families, mailed directly to their homes. We have launched pilots in each of those outcome areas that I mentioned earlier. So we have a childcare pilot. We have a pilot we're contracting with National Center for Families Learning, NCFL, to support our healthy development work. So each of those groups have partners and work moving alongside them. In the policy space, we were able to make considerable updates to Jefferson County's land development code to better support childcare, so that it lessened the restrictions of the land development code to support childcare, reopening, expanding, those sorts of things. Never did I think I would be such an expert in land development code, but this is, what our coalition identified as wanting to be advocating for, and that's what we move forward with. We also did a lot extensive advocacy at the local level for allocation of ARP dollars. So Jefferson County received over $300 million in ARP funds. Through Ready for K's advocacy, we received 7.5 million dedicated to early care and education. We're still waiting to see what the next steps for those funds will be. We've done extensive promotion and support for families on CCAP when the Child Care Assistance Program for childcare, when that was recently expanded. And then we've done research projects. We did recently just wrapped one up with Jefferson County Health Department on the experience of birthing parents in Jefferson County. And then also at the state level, we were big supporters of House Bill 499, which created a child care partnership with employers and parents and the state to fund child care slots for as a benefit, as part of your benefits package from your employer. So I'm going to stop there. Here's my contact information. Please feel free to reach out to me. I'm happy to discuss any of this further. There's also the link to Ready for K's website. I will throw it in the chat as well as my email. But happy to, I know we'll do questions at the end with Rufus. So I will pass it back to you, Rufus.
Wow, thank you very much. I do appreciate that, Ashley. Yeah, there was a question that was in the chat, so I'll send that. We'll talk about that later in the as time permits toward then. So at this point, we'll go ahead and let Jen Harris from Todd County Health Department speak. Jen, you're up.
Can you hear me?
Loud and clear. You're good.
Great. Thank you. And I can see, thank you so much, Alexandra, for putting my PowerPoint there. I'm just gonna, that looks great. So we're gonna go with that. I'm not gonna try to be techie over here. I'm Jen Harris, Public Health Director at Todd County Health Department in beautiful Western Kentucky. Elkton, to be specific. We're on the Tennessee line between Hopkinsville and Russellville. So it's beautiful this time of year. I know you all are experiencing some of the same beauty in your areas. So a little bit about the Access program. This was a partnership between our local health department and our local school district. We have a very small school district with 4 schools, 2 elementary schools, 1 middle school, and 1 high school, which encompasses about 2,000 kids and another approximately 500 staff as part of the school district. So we have been a partner with our schools since 2009. When I came to Todd County Health Department, one of the programs that we worked really hard to implement was the school nursing program. So we've had that in place since 2009 and have worked very closely with our family resource and youth service center coordinators to implement health education programs such as puberty, abstinence, and programs through the health department. One thing that I think school staff were a little bit worried about in the beginning was this was going to be a duplication of services offered by our local school system through guidance and family resource. But I think we've built a great program that expands on what family resource and guidance have to offer in the school system and hopefully take a little bit of weight off them in connecting these students to in-school services and out-of-school services. So we'll get started with the first slide. I want you to meet our staff of the Access program. We started this program when the superintendent of schools came to me after they got ESRA funds, which was special funding that the school system received because of COVID. And he said, I just want to do something really smart with our money. And so he asked me to create a mental health case management program, much like our school health program. So we took our school health model, the nursing model that we were already offering in the schools, and we hired 3 bachelor degree social workers and then 1 certified social worker. One of our bachelor level social workers is bilingual, which is very important in our community. We have a very large Hispanic population in our community. So we wanted to make sure that all of our students and parents felt comfortable interacting with our staff. So currently we had 4 staff. Just last week, we hired another bilingual staff to our group as a part-time bachelor level. She has her bachelor's in psychology. So she's a really good fit to our program and we're excited to see where things go. And then on our next slide talks a little bit about the referral process. So how do you use the Access program? In the beginning, we utilized the students who were already receiving in-school services. That's kind of where we started. We reached out to those parents to see if they would be interested in our staff case managing their services so that we can make sure, one, they were getting the services that they needed, and then number two, that there weren't any services that we were overlooking. So we gained a lot of students by doing that. This is a voluntary program, so we have to get parent consent, and parents were able to agree to allow us to case manage the services that they were receiving through the school. So we added that to our contract, kind of going back a little bit. We added that to the contract that we already had established with our local school system. And so we were able to carry out the services in a referral process. So initially, anyone can make a referral. We have a universal referral form. We have educated staff and community partners about the referral form. If they have a child that's come to them and has some type of need, we want them to fill out a referral form. If there's a student or a staff person that's come to someone in the community or to another staff member who has some type of social, emotional, really any kind of need, we think the referral form is appropriate. And so that's available to all staff and community partners. And then the forms are sent to our supervisor. We have a supervisor for our Access program. She's going to take those forms and just make sure that we have consent for services. If we do have consent for services, we go ahead and do an initial meeting with that student or staff person. If we do not have consent for services, then we reach out to the parent or guardian of the student to receive a consent. That way we can, they know what's going on and we can meet with the student. So the next slide talks a little bit about the customized needs assessment that we do. So we've used a very familiar program in the health department world called the HANDS program. We've kind of used that framework in how we weight the clients that we have that come in and assign them to a case manager. So we have kind of a weighted needs assessment. So some kids are going to have very minimal needs. They may just need some nutrition education, or they may need some toiletries. It may be something very simple. Some students are going to have, needs that are a little bit more substantial. For example, they may be homeless, or they may not have reliable transportation, or they're not able to they're not signed up to catch the bus to school. So we've come in contact with lots of different situations as we've gone along. So our clients are based on the need. We use the needs assessment to base, how much need and how much help they're going to need, and then we assign them to one of our case managers, and then the client is added to our database so that we can track them. So one thing that we want to do is to be able to track the student to see if they're getting the care, getting the resources that they need. And, a student may have received all the resources that they need at that particular time, and we deactivate them from the Access program, pending if they need to be reactivated. So the next slide is going to show a little bit about what our case management looks like. So intake means that we're just going to meet with that student to assess their needs. We're going to identify if there's any family or household needs. That's one thing I'm really proud of about this program, is we not only are assessing the students' needs, but there may be some things in the home that are needs as well. And we've identified several of those and been able to help parents and guardians with those, which helps the student in school. We do home visits from time to time if we feel like that's necessary. We have been asked by parents to come to the home to meet with them. They feel more comfortable meeting one-on-one, but mostly we're talking to parents over the phone or meeting with them in our office. So each child at intake, we establish goals and a service plan for that child based on what needs they have. And then we start to connect them to services. And some of the services that we have available in the schools, we have 2 mental health agencies that do in-school mental health therapy. So we have Mountain Comprehensive And we also have Pennyroyal Center, both mental health agencies that are able to do that. Our health department hires a community health worker, which has been really, really helpful to us, especially when families have a need. So we can point that community health worker to the family and they can help with some more intensive needs in the household. And then we also have access to crisis management and assessment, which has been very, very helpful this year. So we have our in-school therapy, but there, from time to time, we have clients who have some type of crisis situation where they need immediate assessment. Before, we had to arrange transportation for the client and the family to get to that crisis management. Now we have established telehealth within our offices so that the crisis management can be done immediately. And that's been a game changer for us and really, I think, helped us move forward in what we really want to get out of this program. So we track the progress, we reevaluate as needed, we change the goals as needed, depending on what the student or client is going through. And then the next slide is going to look at some of our service connections that we provide. So parent involvement is going to be key. We educate parents about their options and we let them choose. So, our mental health counselors within the school have very different strengths. And so we're able to talk to parents about, what type of mental health professional their child may really need to see. And we let them make the decision what direction they want to go. So that's been very helpful. Services can be short-term. Some of the services are long-term. So some of these kids, are in more intensive type therapies where they're being seen several times a week in the school. Some are just being seen monthly for things that they need to talk about or resources that they may need. All of our services are voluntary and free. So we have had situations where we felt like a student needed help, but we just couldn't get parental consent for the student to get help. That's an unfortunate situation. And what we try to do in those situations is just try to arm the parents with as much information about outside resources that we can. We don't want there to be any kind of barrier. And we have had some parents that have come back around for assistance from the Access program. But, it's voluntary. That's hard. It's a beautiful thing. That can be a beautiful thing that it's voluntary. We're trying to empower parents to make good choices for their family, but sometimes it can be very frustrating. So the next slide shows a little bit about the data that we've collected so far. So this is data from when we started the program last year. Last year was our pilot year. And so this year we're really going strong. We've had a total of 352 referrals to our Access program since we began. Some of those are duplicate referrals. Maybe a child is referred in August, they have some type of short-term plan, and then there's another referral in December. So, not necessarily 352 students that this represents, but 352 referrals. Of our referrals, 307 of them are currently active referrals, 45 are inactive. So inactive would mean that we met whatever type of goal was established for that student, or the parents withdrew them from services, which isn't very common, but it does happen occasionally. On the graph, you can see the yellow are the total number of cases and referrals. The red is going to depict the active cases, and then the blue bar are going to be the inactive cases. And I will tell you, just in looking at this graph, it really makes a difference what kind of guidance counselor and family resource center coordinator you have at your school. I feel like the schools with the strongest staff typically have the most referrals, and the number of active referrals, especially at Todd County Middle School, I think speaks volumes. We have a very involved guidance counselor at that school. We have an extremely involved family resource center coordinator at that school. Not that the other ones are not involved. That's, not necessarily the case, but at the middle school, we have a really seasoned guidance counselor that she's very, very involved, and it makes a big difference in our numbers. Our next slide talks about incoming referrals. So these are referrals. This is actually last August through last February. You can see how in the beginning we had a large number of referrals because we were taking those kids who were already receiving in-school services. That's who we started with. And then as the year went on, our referrals went down. And so we looked at that. We looked at how we were accepting referrals. That's when we brought about the universal referral form. And so now, as of last August, September, we're receiving somewhere between 20 and 30 referrals each month to the Access program. So we feel like that universal referral form really did a lot for us. And you can see the 0 number. TCHA is actually Todd County Horizons Academy. That's our alternative school. And so you see 0 referrals there. The reason why there's 0 referrals is those kids are typically already in our Access program with whatever school they came from, with whatever, if it was the middle school or the high school, they're typically already in the Access program by the time they get to their Horizons Academy. So that's why those numbers are a little bit lower. Our next slide talks about school-based services. So like I said, we have Penny Roll Mental Health Center. We also have Mountain Comprehensive Care Center. And then, of course, any student can take advantage of outside services. We have a couple of primary care offices in our community that have mental health professionals. And we certainly, if a parent doesn't want to use an in-school service, we definitely want them to be using an out-of-school service if that's what they prefer. So, that's kind of the breakdown of who our kids are seeing. The next slide talks about case scenarios. I just wanted to tell you a few examples and stories from things that we have encountered. One of the most recent ones is we had a needs assessment with a child who was talking about not having a place to sleep at home. And so when we called the parent, the guardian, we were able to establish that not all of the children in the household had mattresses that they could sleep on. So we were able to set that family up with some bedding and some mattresses so that hopefully those kids were going to be getting a good night's sleep. There was another situation where we had a student that we were seeing for case management services that mentioned they had a younger brother that didn't have a car seat. And so when that family would transport the kids places, there was no car seat for the youngest one. And so we were able to connect them with some outside resources and get them a car seat. We do have gasoline cards for situations where maybe there's a resource that the family needs to take advantage of, but they don't have the means to get there. Maybe they have a car, but they don't have money for gas. We provide gas cards if we know the guardian is going to be getting that child that needs services to that particular service. And so that's probably one of the bigger things that we provide are gas cards. More recently, we had a family, we were seeing a child of 2 parents that were going through a divorce. And the parents were having a very hard time co-parenting. And so we were able to connect them with one of our therapists so that they could learn some boundaries and be able to determine what co-parenting was going to look like in the situation that they were in. So, I think the parents were very appreciative of that. There were some issues between the parents, but they were wanting their children to be able not to suffer as much from the issues that they were going through. Another situation we had with a student who was continually falling asleep in class, and that teacher made a referral for that child to see one of our Access case managers. We did a needs assessment and we found out that there were really no guidelines for bedtime with this student. And this is an elementary age student, so a really young student. And so we were able to meet with those parents and educate them on creating some boundaries about bedtime and social media and online games and things like that so that child could get a good night's sleep. So lots of things going on other than just what you would think of as traditional mental health counseling. We're case managing these kids for all types of social and emotional barriers that they may be experiencing. So the next slide talks a little bit about areas for expansion, and we've actually already done some of these items. Some we still have lots to do. There's lots to do. Our staff are great. They have lots of really good ideas. We just can't seem to get all of them implemented. Hopefully, we're chipping away at them one at a time. One of the things that they did this summer, which was last year was one of our areas for expansion, was a summer program. A lot of the summer programs have kind of gone by the wayside in our community. So they did a summer program called the Little Spot Training. It was once a week for 12 weeks. So the kids came in. It was the little spots were different emotions, and that was the education piece. Was they took a different emotion each week, talked about how that emotion can affect you, made it applicable for elementary school age kids, but also middle school kids. We had some middle school kids that came, and it was very well received. The kids loved it. We even have a big hay bale trail here in Todd County. We have 67 hay bales across our county, and our access team did a little spot. One of the little emotion spots is our hay bale. So the kids can really identify with that. And a lot of them, when they see our access staff out, they say, "Oh, remember the little spot?" So we think it was a really big success. Also this summer, we did some family fun days. So we took a Saturday each of the months during the summertime and had a theme, did a family fun day. It was an opportunity for us to meet with some of the kids' parents that we had been doing case management with. And it was a fun atmosphere for them to see our access staff. We don't want the kids to associate our staff with just heavy times when something really bad is going on, but we want them to see our access staff as people that they can come talk to, not just when they have something heavy going on, but when they have a great success in their life. Small groups have been initiated in our high school and middle school that deal with self-esteem, anger management, relationships, emotional regulation. Those have been very well received. We're working through Family Resource and Youth Service Center on those. We have started nurturing parenting classes, which parenting classes were not currently being offered in our community or really our contiguous counties. Those have been very well accepted. We had a meeting with all of our local judges, family court judges, our family court attorneys, to let them know what we could offer through nurturing parenting classes, and to make that something that they could send parents to as a step to getting children back, or as a step to, being a better parent, basically. So we've started those. We had a grandparents class last week that was pretty successful. So some of the things that we want to be able to do, family groups among the students. This is something that came up last week. Unfortunately, we had one of our high school kids who committed suicide last week. And one of the things that our access team is working very diligently on is forming some family groups among the students for support at the high school. And we feel like we may be able to do this through the homeroom or the advisory time. So we're looking forward to working on that a little bit more. Staff needs assessment. We have done a needs assessment for the staff. We have not released the results yet, but it's very eye-opening how some of our staff feel the emotional environment is at the school. And so that's something that we want to work on. We want to expand this program and are in the process of working with our Amish and Mennonite community. Our county has the largest Amish and Mennonite community in the state of Kentucky per capita. So we have it's approximately a fifth of our population are Amish or Mennonite. And so we've got about 13 Amish and Mennonite schools that we would like to replicate the Access program in, and reach out to them to see what types of social and emotional barriers or issues they may want us to work with them on. So that's something that we would like to do in our expansion. So, there's really a lot going on in our schools, and it's much different from when we were in school. Saying that makes me feel really, really old, but social media and the environment that our kids are going to school in is so that they really can't disconnect when they get home. And so I think it's really important. Our guidance counselors have done a great job. Our family resource and youth service centers have done a fabulous job. but it's just, it's heavy. It's a lot of heavy stuff. And so that's one thing that I would like to say. If you decide to replicate this program in your community, one thing that we're doing for our staff today, because they had a really rough week last week with the suicide, we're having a crisis counselor come meet with our staff today, because a lot of the stuff they deal with is really, really heavy. And we definitely don't want our staff to get burnt out. We don't want our staff, we want them to be able to process their emotions when they're helping everyone else with their emotions. And don't forget about teachers and administrators. That is key. They've got to be there for our kids too. Sometimes our kids feel like that the teachers that they have and the administrators are the people that they can go to. So we need to arm them with good education, and also, but be there if our teachers have social and emotional issues that they need to work through. And our Access team is always available to the school staff. We can case manage any mental health or social and emotional needs they have as well. So funding for the future, I'm not sure if I put a slide on there about that. It may just have questions, but funding for the future, the ESSER funds are going to run out. I mean, we know that COVID money that the schools got, it's going to run out. So we have already been working very diligently on how we're going to continue this program and where the funding is going to come from. Our community has been extremely supportive of the Access program, and we have gotten a lot of funding from community organizations, but we know in order to sustain it, there's going to have to be more funding. So the good thing is a lot of grants are recognizing mental health as public health, which it is. And so that's a good thing for us. Hopefully we're going to be able to apply for some grants to be able to continue the good work that we're doing. And I don't know if anybody has any suggestions on how we can make this program better. We're always open to that.
Jen, thank you so much. I appreciate it. It's a great program. We've got one question in the chat for you, but we'll try to, if time permits, we'll get to it. So right now we're going to turn it over to Dr. Boone. Dr. Boone.
Yes, thank you, Rufus. Good afternoon, everybody. It's great to be with you. I'm really looking forward to chatting with you all a little bit. I'm a workforce development practitioner and have been for several years now. And workforce development has a very close alignment with physical and mental health. So very innovative and forward thinking of the Foundation for Healthy Kentucky to want to talk about workforce development, given its relation to health overall. I'm going to talk really about two organizations, and I might pull some slides up a little bit later on to illustrate. But I'm going to talk really about two organizations and a few different programs. The first organization I'm going to talk about is the South Central Workforce Development Board, which is based in Bowling Green, Kentucky, and serves the 10 counties of South Central Kentucky. I was the president and CEO of the South Central Workforce Development Board for a few years, and we were able to put together as a team and through partnership some good programming to really help the residents of South Central Kentucky find gainful employment toward upward mobility. We really started with a strategy, though, and I want to talk a little bit about that. We saw in our organization workforce development to be a system. And I think that a lot of public workforce entities, just like a lot of other entities, get very siloed and get very focused. And it's great to have focus. But we really saw the necessity to have a system that we wanted to put into place that would include health departments, public schools, K-12, private schools, higher education. The list goes on, because just about everything we think of touches workforce development in terms of helping people prepare for the world of work and find jobs at a good wage and help them provide for themselves and their families. So first and foremost, workforce development is partnership and it's systems building. So we wanted to create a system of referrals using technology and other means to really leverage resources in our communities to make sure that career seekers from point A to point whatever the stopping point was for them had really a seamless delivery of services. And many times, as we all know in this space, individuals with barriers to employment also have other barriers. And sometimes we are the only touch point. The Kentucky Career Centers, in this case, are the only touch point perhaps for that individual. So it's really ideal to be able to be knowledgeable of other services. And in fact, in our centers, we were a frequent user of 211 with United Way to really help identify other services in real time for our career seekers who would either come into the center or that we were helping through remote access. The other component of this is increased accessibility. We know across the state that accessibility is key in providing the best workforce development or social services that we can. And oftentimes our participants struggle with transportation barriers, childcare barriers, also time of day barriers. Many of our Kentucky Career Center locations across the state, and this was certainly true in South Central Kentucky, were open 8 to 4:30, and there's very little control that partners can have over the operation of those centers due to staffing capacity and other limitations. So we really had to find a way to leverage resources in the 10-county area to serve our participants better. I am just going to pull up a map here for illustration. So I will share my screen. This is from a presentation. I'm going to be pulling from this a little bit. This is a map of a sample workforce region in Kentucky. This happens to be the South Central Workforce Development Board region prior to 2018. You can see in green 2 American Job Center or 2 Kentucky Career Center locations, really with about an hour or more away from some of the more rural areas of the service region. As I mentioned, the AJC hours of operation, AJC stands for American Job Center, roughly about 8 to 4:30 Monday through Friday with limited staffing capacity. So what we were able to do over a period of time is really add access points within our communities, utilizing existing resources at public libraries. So for example, our staff cross-trained some library staff in basic career services so that if a participant was closer to a public library than one of our career centers, he or she could then go into the library and get a basic level of career services at the library location. Apart from that, we connected all of these bricks and mortar access points together through 24/7, 365 technology access in the form of Kentucky Career Edge. That's what we call the program, which enabled remote access career preparation that was available on kiosks in libraries and other access points such as adult education centers, career and technical centers, food banks. We had a Job Corps center, and really the list goes on with partners. But the program was also available through a participant's mobile device as well and was real time. And the program, Kentucky Career Edge, has an administrative portal where career advisors, case managers, guidance counselors, whomever has access and is helping the career seeker along the career journey can log in and leave real-time feedback and grade assignments, which really helps with the scalability of staffing capacity and also really increases accessibility. Also, we wanted to make sure that we had impactful training programs. And through an analysis, we really found that the best programs for the participants that we were serving during this given period of time were generally short-term trainings, really at the post-secondary level. One of the biggest successes we had was with commercial driver's license. And prior to 2017 in South Central Kentucky, there was no CDL-A training or B training program in the 10-county area. But when looking at the data, this was constantly the most needed occupation within this region, which only makes sense given the I-65 corridor, which runs directly through Bowling Green and other parts of the service region. So with a grant through the Kentucky Education and Workforce Cabinet and in partnership with the South Central Community and Technical College, SkyCTC, we were able to start a CDL program that has served to date a few hundred participants. And I want to speak to this directly because, and more specifically, because we were able to really reach in and serve some populations that really struggled in the traditional public workforce system with finding gainful employment. I know we had about 3 participants at least who were homeless and were able to enter into a CDL program through partnership with Hotel Inc. In Bowling Green. We were able to secure funding for hotel rooms for the 4-week training, and the participants were able to be transported every day during the 4 weeks to the CDL site for training. And after 4 weeks, they all were able to graduate and pass their CDL licensing exam, which really enabled them to make on average about $55,000 to $60,000 a year. And a program like this is really meaningful, especially for individuals who are experiencing homelessness, because you can physically live in the truck while you're doing longer drives. And that's very impactful because it enables the time and necessity for someone to really save up the necessary funding in order to get on their feet and rent an apartment and do all the types of things that employment brings to us. So this is one program in particular that I wanted to highlight, but there are others as well. We also started a computer coding academy that later became known as Commonwealth Coders, based on a more entrepreneurial need in the state, and really wanting to look at the gig economy and enabling a higher tech and also short-term option for individuals in our area that had barriers to employment and were seeking gainful employment. Finally, we really focused on first-generation career seekers. And this is a term that we really researched in our area, and we're able to write about pretty extensively from an academic standpoint. And first-generation career seekers really, the concept is really based on the literature of first-generation college students combined with literature on cultural capital. So we really kind of married those two bodies of literature together and looked at it through our practitioner lens. And what we found were, many individuals lack the necessary cultural capital in order to really effectively navigate the world of work. They really kind of lack the nuanced understanding of essential skills, for example. I know many of us talk about essential skills like showing up to work on time and not calling in, and we can all think of all these skills that are very, very important to us, but many people lack the nuance and understanding the world of work, and therefore are shut out of the pipeline for employment or sustained employment, but also upward mobility, which is something that we really strive for in the public workforce system, is not just employment and sustained employment, but the opportunity to advance in employment. And that's another reason why short-term credentials are very important, because they really enable a career seeker to begin work relatively immediately. And short-term credentials and work experiences like apprenticeships and other work-based learning opportunities are really foundational in latticing, an individual latticing himself or herself up the career ladder and advancing in employment. Work-based learning is also a very foundational piece to help first-generation career seekers really contextualize the world of work and make meaning of it, so that the nuances of the world of work can be understood, and so that they can effectively really navigate toward employment and upward mobility. I will show you just a couple of examples of one of my partners. This is the Bluegrass Workforce Innovation Board. They were able to install, as I mentioned in South Central, what we did. Bluegrass Workforce Innovation Board was able to install kiosks into public libraries in their 17 county workforce region. And again, library staff were cross-trained. The kiosks were outfitted with a screen with open job postings as well as employability resources. And this is really important because the kiosks served as an entry point, not only for remote access services, but also for in-person services. Because what we were wanting to do really with this concept is make the front door of the Kentucky Career Center bigger and more accessible to people. So we wanted to have access points leveraging technology where individuals could go, and then we would have their contact information and a certain level of understanding where they were in the career journey. And that really enabled our staff who were in bricks and mortar career centers to then reach out. And we know that we wouldn't have been able to reach this many people without the ability of technology to meet people where they are and to help them move toward employment. We also, in the Bluegrass region, were able to build kiosks in addiction treatment facilities. The Isaiah House in the Bluegrass area, for example, through a grant of 30 recovery centers in 17 counties, were able to install kiosks. And this is really important for a referral process, because when entering the facility, the individual, the career seeker, the individual seeking treatment really needed to be able to find employment relatively quickly. So we use this technology and in-person facilitation as a supportive service to be able to help people find employment who are seeking treatment. And the important piece of all this is it's around-the-clock access that really limits barriers to transportation, to childcare, and to other barriers. So this is an example of one of the kiosk centers that the Bluegrass region installed in a public library. And as you can see, it's a screen that's interactive with some literature. So we also are moving as a company. The second organization, as I mentioned, I'm going to speak about too, is Career Team, my current employer, where I work nationally as a workforce development consultant, and also am highly involved in the arena of software implementations on large scale. And I will have to say that one of the projects I'm most excited about right now is a project that we're engaged in with the state of Missouri, Department of Corrections and Department of Labor partnership, where we are serving 19,000 inmates in 16 jails and detention centers across the state. And what we were doing is combining in-person instruction in jails and detention centers with our technology, so that at least 6 months prior to reentry, returning citizens can be able to create all of the career resources they need: a resume, cover letter, a job application, and many more items that are contained within one electronic spot called an e-portfolio. And the returning citizen then has this material where they can then apply to positions while in incarceration or shortly thereafter. Of course, the old model for delivering workforce development services in a jail, detention center, or prison often was a piecemealed approach, where workshops would happen in the facilities, but there was little work product that the inmates could really use toward employment. So we are really standardizing the curriculum in the state of Missouri, and also tech enabling our returning citizens to produce meaningful employment material prior to reentry, connecting it with the state's labor exchange, which is where anyone in the state would go to find employment, and really enabling our returning citizens to find employment much sooner, and also enabling them to reduce the chances of recidivism, because we know that the number one indicator for recidivism post reentry is lack of employment. So what we're trying to do is really trim down the time in matters of days or weeks that an individual reentering from incarceration can find employment. So again, thank you all for the invitation to join this panel. I will turn it over to Rufus.
Wonderful, and thank you, Dr. Boone, for that great information. Thank all the panelists for your presentations this afternoon. There were a few questions specifically in the chat room, so I'll go ahead and read a few of them. The first question was for you, Ashley. The question came in regarding your program. Is the cooperative extension a part of the Ready for K Alliance?
I'm not familiar with that partner, so I don't believe so. But I will just flag, as far as partnership, and as Dr. Boone was talking, I was thinking I should have mentioned this, that really when building a coalition and thinking about partners, there's probably going to be the, the top 10, 20, 30 that come to mind immediately, but really thinking outside of that box on who partners really could and should be, no matter what the issue you're trying to address, and really sort of expanding that idea. So very specifically in the early childhood space, one of the biggest things we've pushed for, which is why I thought of it when Dr. Boone was talking about, was partnership in the workforce space. So partnering with our local chamber, partnering with Kentuckiana Works, those types of institutions, because childcare is such a barrier to employment and also is an economic factor. When people cannot go to work, then that affects their own, all these different, this layering, and then all the, the tax base decreases, and it's very complicated, but it's when you're thinking about partnership, being open and, looking for those non-traditional partners who may not have been in that space, whatever space it is you're operating previously. I highly recommend still reaching out, figuring out what that connection could potentially be, because there probably is one, and really just taking the time to expand outside what you may all think are your, your go-to, your traditional partners that you work with all every day, all the time. So
Yeah, that was one quick follow-up. I was going to ask it. The question was that, are there community partners that you're missing that you would ideally love to have as partners in the Ready for K Alliance?
Yeah, so I think one of the biggest groups of partners that we are hoping to engage better that we haven't been able to is local businesses. And again, highlighting that workforce piece is that we know right now that childcare is such an issue for individuals and is really affecting workforce participation, and that we really feel that there should be some partnership there with employers themselves. We have in the Louisville area, we have a lot of large corporations that are big employees. So how can we better engage them in conversations around supporting their employees that really is directly related to the child care space?
Good. Just one quick follow-up question that came in. What unexpected barriers have you encountered specifically in implementing a collective impact model?
I would say probably and this isn't a barrier. This is, just the process of having such a large group of different partners who each have their own work, their own interests. You really need to be able to navigate that. And that's where a backbone organization can come in as a really key piece of this, because that staff member or staff members can really be making sure that follow-up conversations are had, time is spent making those connections with partners, hearing what that specific organization's interests are, and then making sure those interests come back around to the conversation so that partner feels heard. Honestly, it's a lot of time and people power just to make sure that you're investing the time and getting to know your partners, and it feels like it's very simple things, and it is grabbing a cup of coffee now that we can, be back in person. If you're comfortable with that, meeting, I try to meet several partners, every month. I try to reach out to a handful of partners just to reconnect, and that's so much a part of it, as well as will help you reduce barriers down the line, because you will have grown that relationship, you will have grown trust between that organization and the work that you're doing and the coalition. And then down the line, when there may be a new initiative that you're trying to get off the ground that they don't specifically align with, you can reduce the issues that may come up by having that trust, that relationship already established, and knowing we're still working in partnership with you, but it may not be this specific thing. So time is the biggest piece, and my biggest recommendation: take it and get to know the partners really, really deeply, understand the work that they're doing, so that you can then make sure where it's necessary and needed that they're looped in, and can advocate for them too, so that you're just aware of what's going on. Good. So it's a lot.
Thanks. Jen, a question for you. Have you heard of any other health departments in the state that are looking to replicate the Access model?
No, I haven't, but we're certainly willing to share our information.
Okay, good. And Dr. Boone, what has been a key in establishing interest in communities to implement these innovative programs, both in workforce education and reentry?
I think really leadership has been sort of the theme that I've noticed in the areas that we work that really want to do things differently in this area. It's generally the openness of leadership, also leadership that is wanting to network and learn from other areas about what they're doing, and an openness. I think that's pretty much the single trait I would see in really implementing whether it be technology or access points, or really a real focused strategy about how to reach, say, for example, individuals who have been historically underserved by the public workforce system. I think really it all starts with leadership. And in the field of workforce development, that's not always and shouldn't be one single person. It should always be really a partnership, maybe one person sort of driving it or a small group of people driving it, but it takes really a lot of people, local elected officials, nonprofits, healthcare providers, school systems, other workforce organizations. So that's what I would say based thematically on what I've seen really across the country.
Yeah, okay. And Jen, I know that the Access program is fairly new, but there was a question that came over. What are your expected outcomes for the Access program?
Well, I think the biggest expected outcome is that we want to center all services. So if that child has a disciplinary referral and they're getting in-school therapeutic services, then we want to make sure that the therapist is aware of what's going on so that next time they meet with the child, that can be addressed. I think those things haven't been addressed in the past because the therapist just hasn't simply known about it, or the referral hasn't been made, or, it's just been dealt with in the classroom, or maybe the parent was called, but the parent didn't relay that information to the therapist. So we're hoping that everything that's going on with that particular kiddo can be centered so that all aspects of what they're dealing with can be addressed.
And Ashley, in the Alliance, is there, you didn't speak about the parents. What about the parents as a team in the Alliance?
Yeah, so that is a population that the Alliance has not been formally connected to previously. So the way the Alliance was originally structured was that it was a coalition between community partners. A lot of those partners, of course, themselves are parents, but that's not the role they serve as part of the coalition. That is actually changing. That is a new initiative that we are shifting our work. Our healthy development work group is in the process of launching Ready for K's first ever parent and caregiver advisory board. That work is a new outcome area, a new focus area for the Alliance, and they really wanted to work in partnership with the families that they hope to serve and create policies and programs to better those outcomes for those families. They want to co-create it with the families themselves. So that's a brand new venture for the Alliance. It's a very big shift in our work. It is currently underway, but if that's something you're interested in, I'm happy to share more details. Feel free to reach out to me. But yes, historically, that has not been our model. And how we have structured reaching families is through those community partners. So say our our local school district is having their annual open house for schools. We then share that information with community partners and then ask them to share it with the families that they serve. So that has been historically our reach to families, is through those community partners that already have connections to the families.
Great. Dr. Boone, I just have one quick last question. You mentioned about the American Job Centers as far as the hours of operation. What would be the ideal and most effective hours of operations for the American Job Centers?
Really, I think that every region is different. So what I would have done in South Central, if we kind of ventured into being able to keep the center open longer, would be just to listen to the community that we were serving And just like any organization, we would do, market research, and we would also try some different times and, keep track of who was coming in. And so I can't really say what the ideal hours of operation would be. But I do know that based on experience and observation and talking with people, that 8 to 4:30 works for a lot of people, but there's also a lot of people that it doesn't work for. And that's really why we brought in partners that were open different hours and different locations to increase not only geographic accessibility, but also hours of operations accessibility, but also overlaid technology on top of our operation to even get out of bricks and mortar, so that hours of operation and childcare and transportation aren't as big a issues. Granted, there are issues with internet accessibility and computer proficiency. Those are still very much issues, but we figured that we were better to have that technology option than to not.
Got it. Well, I want to thank you all for your incredible information you shared today with the group, and we're greatly appreciative of it on behalf of the Foundation for a Healthy Kentucky. I can't thank you enough, Jen, Ashley, and Dr. Boone, for your time today in sharing this incredible, important information with us all. So with that in mind, I don't have any more questions in the chat. So if you would like, there is a wrap up here in roughly about a minute now. So we'll be able to switch back over. Is that correct, Allison?
I'm just going to take it from here, Rufus, so nobody has to go anywhere.
Fantastic. Okay, great.
Thank you so much, and thank you to our panel and for everyone who stuck around with us for the end of the day. I know you found that last panel very valuable in building community partners and finding non-traditional friends to reach your mission together. So thank you for joining us today for these insightful and inspiring conversations and presentations about how we can improve and make more accessible education opportunities with the power to lift Kentuckians so that they may thrive and be healthy. I can say I'm inspired to go out and do good, and I hope you are too. Just to wrap up, we've examined how social safety net programs impact students in rural and urban areas. Critical literacy lessons that help people address and overcome life's challenges. We talked about inclusivity that fosters systems change, the power of families and breaking generational cycles through education opportunities, and how Kentuckian and community partnerships are lifting Kentuckians of all ages. And just a couple of take-home messages for you and some charge of action. The participants that we've had today have been engaging, and I know we have a lot of folks out there who are excited to get to work. So thinking about what you can do to close that racial divide by working together with rural and urban communities, overcoming those false dividers to reach out and plan policy improvements together across urban and rural areas. Think about how you can go find out your local school's corporal punishment policy and get involved in local school boards and understanding where you and your organization and where you can build capacity to help foster that Stronger Connections grant and bringing that community back to those funds back to your community to help create safer and healthy environments for students and families in schools. Think about what your communities look like and go foster those relationships for change, especially when you think about moving literacy to capability. So it's not enough to just know, it's how do we build platforms for action. Also thinking about what you can do in your community to spread the word about to apply for student loan debt relief, knowing that application is out there and ready for Kentuckians to take advantage of. And don't forget to ask your legislators to review policy funding mechanisms that fund higher education and higher systems and how that impacts Kentucky's workforce and supports for our Kentuckians moving forward. And finally, thinking about those policy considerations that care about one group does not mean that we care less about any other group. It just simply means that we are shifting our focus to the group that needs assistance most. And so when you think about moving to galvanize your community, remember that word, galvanize your community, to around a vision for policy change that puts youth and families first and at the center, I think is where our future lies in education as improving outcomes for Kentuckians in the future. The future is with our families and our youth, and that's where the policy implications can be most effective. So we want to know your thoughts about today's BOST Forum and your feedback on the topics and how they've inspired you to take action. You will soon receive a survey, and we ask that you please respond and let us know what you thought about this year's forum. Your input is greatly appreciated and will be used for future reference in improving our BOST Forum, whether we stay virtual for 2024 or 2023, or whether finally we'll get to reconvene in person. We'll also be posting the sessions on our website, which is healthy-kentucky.org, so you can watch again or share with others who are unable to attend today. Also, we intend to further examine these topics and lift up successful programs across the Commonwealth through our Health for a Change series. Please let us know what topics you would like to have more information and more in-depth that you heard today. We know that this was really comprehensive day, but also a lot of opportunity for more in-depth discussions and more policies and more successful programs that are happening across Kentucky that the Foundation for a Healthy Kentucky can help share. Keep watch for announcements about when those programs will be available, and that will be offered through the Foundation for Healthy Kentucky's platform called Health for a Change. And finally, we invite you to follow Healthy Kentucky on social media, and feel free to reach out to me by email at Allison Adams, aadams@healthy-ky.org. Thanks again for attending today's Howard L. Bose Memorial Policy Forum. In the words of Mahatma Gandhi, you must be the change you wish to see in the world. I challenge you to take today's information to speak up for education as a cornerstone for Kentucky's health outcome. Find your courage. Have a great day.